When managing a nasogastric or NG tube, begin by verifying the healthcare provider's orders and checking for documentation to confirm NG tube length. Refer to your agency policy and procedures on NG tube placement verification and irrigation. After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify him using 2 identifiers.
Can you tell me your name, please?
Greg Wilson.
All right, and state your birthday.
1856.
All right.
Next, assess the patient. Ask him if he has any nausea or abdominal pain and auscultate his bowel sounds. Suction should be turned off before checking bowel sounds. If the patient is receiving intermittent tube feedings, check tube placement immediately before you begin feeding the patient or administering medication through the tube.
Okay, let's adjust this pillow for you. All right, you can lean on back. Okay. I'll put some gloves on now. What I'm going to be doing is checking placement of that tube in your stomach.
To obtain aspirate, begin by drawing 30 milliliters of air into a 60 milliliter syringe. Attach the syringe to the end of the feeding tube. Flush the tube with 30 milliliters of air before attempting to aspirate stomach contents. Reposition the patient from side to side if necessary. More than 1 bolus of air may be required. Slowly draw back on the syringe until you've obtained 5 to 10 milliliters of gastric aspirate. Note the appearance of the fluid. If you're unable to aspirate fluid from the tube after several attempts, check to make sure an X-ray has been done to confirm placement. If proper placement has already been confirmed and the patient has no risk factors for tube dislocation, monitor the external length of the tube and watch the patient for signs of respiratory distress. Once you've confirmed tube placement, prepare to irrigate the tube. Remind the patient that this will be done before and after he receives medications, and before and after tube feedings. Now, draw 30 milliliters of water into a syringe. Be sure your patient has his own bottle of irrigation fluid. Change the bottle every 24 hours.
Your stomach, I'm going to go ahead and flush it for you, okay?
Kink the NG tube when you disconnect it from the administration tubing or when you remove the plug at the end of the tube. Insert the tip of the syringe into the end of the feeding tube. Release the kink and slowly instill the irrigation solution. If you're unable to instill the fluid, reposition the patient onto his left side and try again. When the water has been instilled, remove the syringe, reconnect the tubing, and reinstitute the tube feeding or administer medication as ordered. Dispose of used supplies. Remove and discard your gloves and perform hand hygiene.